So coping strategies. So we talked about causes, talked about symptoms, talked about treatment, and now we're going to go into coping strategies. Okay, so that's my agenda. Okay, so whenever it comes to back pain, leg pain, and disc injuries, there's more than just a physical component to the injury. Okay, there's also an emotional component. I've seen almost all my patients with chronic back issues, leg pain issues, and disc injuries really suffer at an emotional level. Okay, so obviously, I cannot consult on the emotional level. I'm only consulting at the chiropractic spinal level in my office. But I want to give you some coping strategy you can deal with if you're going through some hardships with that. Okay, first of all, stay positive. It doesn't help you to pound and feel negative about yourself. Like, I see a lot of the comments on my YouTube channel saying that my back pain is like a killer, and I just feel like killing myself, or I don't know what to do. My life is over. Like, I'm 21 years old with an L405 disc bulge and I have so much pain, and my life is over. Well, no, your life is not over. It's not, right? Especially if you're that young, right? So stay positive. All it means is that you haven't found the right answer or solution to your problem. That's all it means. And you just need some guidance. So stay positive. Know that your body has an ability to heal. And you don't have to believe me on that, okay? Don't believe me if you don't want. But your body has the ability to heal. And I'll give you some examples. If you've ever had a cut on your hand or scrape on your leg or whatever, and it's been bleeding, right? You're going to cover that up with a Band-Aid and protect it and clean it up. But eventually, after a couple of days, you remove that Band-Aid, your hand and that abrasion actually healed. It healed from the inside out. It starts to form immune cells on the inside of the cut and begins to scar from the inside out, and eventually closes, and it heals, and that scar falls off, and then eventually you have brand new skin, right? Your body did that. No doctor did that. So the same concept that heals cuts and broken bones, right, in your body will also heal tissue injuries at the level of the disc, your spine, and other areas. So just know that your body has the ability to heal. And if it's not, there's got to be some interference in that pathway that's not causing it to heal properly. Now, I want you to understand, as you know, if you look at, there's not a brain, actually I have the brain here. So here's the brain, right? So the brain connects with the brainstem and then send messages all the way down your spinal column to all these nerves, to all your body parts, right? So let's see. I have that poster behind there. Let's have one in here. I don't have it here. But anyways, so the poster there, let me see if I can, right there. Okay. So you'll see there, right, the brain, brainstem, spinal column, all those spinal nerves go to all your organ systems. So all of your body's ability to control your systems and your healing and your tissue repair comes from your brain, and those signals have to flow through your spinal column because the spinal column protects the spinal cord and branches out to all those nerves, to all your body parts. So if there's interference along those spinal nerves, your body cannot function optimally, you cannot function optimally as a human being, and you cannot heal and repair optimally. So what that means, you need to discover if there's any interference on that, and that's what chiropractic helps with. So do stay positive. Do know your body has the ability to heal, okay? Another thing too is get support. Don't be alone on this. Get support from your, if you're married, from your spouse, your partner, your parents, your siblings, friends, right? If you need someone to bring you somewhere for treatment, get them to drive you there. If you need positive reinforcement, mental positive reinforcement, get that from your friends, encouragement. Find doctors and therapists that will support you positively, right? Okay, not doom and gloom, okay? On the thing of staying positive, also stay hopeful. Okay, stay hopeful. Okay, stay hopeful and stick it through. Okay, and if you've done something that's just not working, then go find something else. I gave you some options already inside this video, right? One of the missing things that most people don't do is because they're just not aware of it, and that's what my channel is about, is they don't know that chiropractic can actually help with spinal distortions and spinal injuries and disc injuries and leg pain. So look for a chiropractor in your area that is skilled on correcting spinal problems related to disc injuries and leg pain, okay? And the last thing is this, is get help. So on my channel, a lot of people are asking me what to do, right? What exercises, what should I do? I have this L405 disc bulge, L5S1 disc bulge. What do I do? So my question is to them, what have you done so far? And many will say, well, I haven't done anything yet. Well, the first step is to go get help. Go see your family doctor. Go see your medical doctor. Go visit a chiropractor. Go visit a physical therapist. Now, I know that in some parts of the world, there's no access or very little access to chiropractic. So, for instance, in India, a lot of my people follow me from India. Most areas in India do not have a chiropractor. That's unfortunate because we need more chiropractors in those parts of the world, in all parts of the world, right? Then look for the next thing that is close to that, which is a physical therapist or a physiotherapist, and then start asking questions about what's your experience with disc bulge injuries? What's your experience with sciatic injuries? Have you got any help with them? What kind of things can you do for me to help correct my back to improve the healing of my back and my disc, okay? So that's the kind of thing. So do get some kind of help, okay? Sometimes if it's not complicated and it's not very advanced, these things do get better on their own, but sometimes they don't. The last thing you don't want to do is don't make this become a chronic problem, right? So people ask me about healing time all the time. So I'll talk about healing time right now, okay? So if you had an immediate onset of back symptoms, back pain and leg symptoms that just occurred within days or weeks, right? And you started treatment right away, physical therapy, doesn't matter, chiropractic, exercise, your likelihood of healing that is a lot quicker than if you waited for getting treatment months later or years later, okay? So the patients that come into me right away with when their injury started, within, I'd say, 2 to 3 months, they're back to almost 100% functional abilities and reduction of pain, okay? 89% reduction of pain, okay? Now, on the flip side, if you go and get treatment and you've had this chronic disc bulge injury and chronic symptoms for more than 6 months to a year and longer, then your recovery time is going to be a lot longer. It can be anywhere from 6 to 12 months if you're doing treatment, okay? So I have a patient right now who's had chronic back pain and leg issues for 8 years, okay? And just started care with us 2 months ago, okay? And her progress is very slow. She has a straightened lumbar spine, distorted spinal sagittal alignment, posture issues, multiple disc bulges, 2, 3, 4, 5, leg pain down both legs, lots of distortions and inflammation. It's not likely to heal and change within a couple of months. It's just not likely because it's so chronic. So the tip I can tell you the best is get in with someone to get this treated as soon as possible. Don't wait. If you ever have an injury in the future for whatever reason, hopefully not, but if you do, then get treatment immediately, because the sooner you get treatment, the sooner you can tackle it during the acute inflammatory phase of treatment. The acute inflammatory phase of treatment is mostly pain and swelling and muscle tightness, that kind of stuff, postural distortions. But the chronic inflammatory stage of treatment is a different cascade of chemicals. Chronic inflammation gets into fibrosis and scar tissue. Once scar tissue sets in there, it's hard to reverse that, okay, or longer. So do start treatment right away, okay? And if you haven't, not to worry about it, just get in as soon as possible with somebody, okay?